So when we talk about cancer basically they are not one disease, but is a generic term for collection of genetic disease which take place when ordinary regenerative processes are disrupted. Okay, so by rapid uncontrolled mitosis and cell division. And these cell types, okay, this disease increase the number of unspecialized cells in particular organs. So means that they just need the number, no quality one. They don't carry out the function. Okay, so at the end, there's something like a parasite. They do nothing, but they absorb nutrient from the surrounding, they invade the tissue from the surrounding and cause the organ failure. Okay, so these abnormal unspecialized cells lose their ability to undergo programmed self-death or apoptosis. So mean they won't die and they will continue to proliferate. And they form a malignant tumor that manage to invade adjacent tissues. They continue to grow, they invade, and worst case, they metastasize. So means that they spread to other organs. Okay, if you say, let's say from the breast, spread to the bone, spread to the lung, so therefore it will cause the metastasis to take place. So during the multi-steps in human carcinogenesis, we have 10 hallmark of cancer that often require. This includes, okay, so out of so many, okay, very important one, guys, highlight this, enabling replicative immortality. So means that this one due to the activity of telomerase. Can you see that? So once means that telomerase activity is high so that they can continue to multiply. If they don't have the telomerase activity, basically they can multiply more because after a few generations, the cell won't be able to multiply anymore. Correct or not? So it means that telomerase activity is very, very high. Okay? Next. Then you can see that they have the ability to activating invasions and metastasis. So it means that they're going to disrupt the normal functions of other cells. Okay? Then they can evade, okay, the growth suppressor. So it means that we want them to die, they won't be able to die, and they sustain their own proliferative signaling. So it means that in this case, they actually prone to carry out mitosis. They don't care about the signaling pathway, signaling from other molecules, okay, from other cells, but they continue to grow. Okay, inducing the angiogenesis. Angiogenesis means formations of new blood vessel. Okay, so this because they want to gain more nutrients. Okay, they also need for the metastasis and they resist for the cell death. Okay, so the most important one actually this one because related to this topic. Okay, so this diagram shows, okay, but you guys, there's for information only in 2011, and Nenner and Winberg actually confirmed this hallmark of cancer. Okay, so the most important thing here is here enabling replicative immortality, where we can have the telomerase inhibitor. Okay, inhibit the telomerase, then we may be able to stop the spread of the cancer. Are you clear? Can you see that? The rest is for informations only, yeah? Okay. So the three main processes during multi-stage carcinogenesis are tumor initiation, initiate it, and then promote and progress tumor, okay? So it's a very complex and multifactorial process that causes the progressions of normal cells into the cancerous cells. But we do know that most of the time due to mutations in the DNA triggered by the exogenous or endogenous carcinogen. Okay? So again, carcinogen, the ideal carcinogen is the agent that causes the cancer. So for example, it can be a physical, X-ray, UV, particularly on the skin. So chemical, for example, lung cancer because of the smoking. Benzene is the one that causes bone marrow disease and leukemia. Paraben is the one that causes the breast cancer. We can the exogenous biological agent, for example, virus, hepatitis B virus cause the liver cancer. HPV, human papillomavirus, causes cervical cancer, or bacterial Helicobacter pylori causes the gastric cancer. So it can be a biological agent, okay? And it might be the endogenous, means that our own, okay? For example, bile acid can cause the colorectal cancer. Estrogen can cause the breast cancer, right? Endogenous means the chemical produced in our body that when we didn't regulate that, okay? So unlike benign tumor, so benign basically is very localized. Benign basically is not dangerous. In this case, we don't call them a cancer, we call them a tumor. Malignant tumor means cancer. Okay? Malignant tumors or cancer, so they have the ability to invade nearby tissue and spreads to other parts of the body. Okay, so the word cancer here, if you know the horoscope, the cancer is basically mean crab. So the first person that described this structure, okay, describe it as a cancer because when you look at the tissues, so if benign, this is benign tumor. We don't call benign cancer. Tumor basically, okay? When I say benign, means that it's very well defined. You can see that very well defined border. We will be able to use a surgery to remove it. But, okay, when you talk about the malignant tumor or cancer, and you can see that it invade something like this. So invasion. So when they invade the tissues already, so the first one that describe this is called as a crab. Can you see that as a crab? Okay, look like a crab in this case. So you do your tissue invasion. When tissue invasion, so we do not know the boundary, so surgical process is more difficult. Okay, so metastatic tumor are very common in the late stage of the cancer. So metastasis means that it spread. For example, it can spread through the blood circulation system or lymphatic system to other part of the body to form secondary growth. So the common place of metastasis occur in the lung, liver, brains, and also the bone. Okay? So if you look at this diagram, okay, so we have primary tumor. Can you see the tissue invasion? Okay? Invade tissues, destroy the tissue, destroy the organ, and they will cause the angiogenesis to take place. Develop more and more blood vessels because they need the nutrient. Can you see that? And at the same time, they may have the ability to detach from the original site, go into the lymphatics or go into the blood vessel, and then continue to grow. For example, in this case, can you see that? For example, from the breast into the lung. So they arise in the organ and they start to adhere to the vessel wall. And then you have the extravasation, means that move out from blood vessel. So when they move on blood vessel, they attach and then it start to have the proliferation and cause angiogenesis. So metastasis take place. So this normally happen at the late stage. So we can see that, guys, if cancer is difficult to remove, let's say difficult to remove, you can see that difficult to remove this tumor, cancer or malignant tumor, but when it metastasizes to other organ, even worse. So it causes the multiple organ failure. Okay, huh? So sometimes you can see that metastasis through the lymphatic system. You can see the invasion of the tumor border and into lymphatic spread. And it spreads to, for example, from the breast into the lung, and where you can see that lung cancer develop. But in fact, if you check the cell type, they belong to the breast cancer. Right? So in situ means localized. Okay, become ex situ. Ex situ means that outside of that particular organs. Right? So with this, I'm done for the cancer part here.